You're listening to the Doc Lounge podcast. This is a place for candid conversations with the healthcare industry's top physicians, executives, and thought leaders. This podcast is made possible by Pacific Companies, your trusted advisor in physician recruitment. I am one of your hosts, Cameron Steinheimer, and I am the marketing manager here at Pacific Companies.
Welcome to the Doc Lounge podcast by Pacific Companies. I'm your host, Stacey Doyle, Senior Director of Marketing. Today is part of our Provider's Perspective series. This series focuses on a physician's journey through medicine and the learnings and advice that they would give to their peers and upcoming physicians. Our special guest today on the Provider's Perspective is Dr. Susan Badidi, family medicine physician. I'm also joined by our co-host Christopher Call, EVP of Physician Recruitment here at Pacific Companies. Well, I'd like to welcome you, Dr. Badidi. Thank you so much for joining us today, and so excited to hear about your perspective.
Okay, all right. Thank you so much for having me, both of you. So I was born in Nigeria, grew up in Toronto, Canada, went to medical school in the Caribbean, and I'm trained at LSU Shreveport. And while I was there, I met my husband, so that's how I relocated to the DFW area. I have a daughter, and she's 4, so I enjoy spending a lot of time with her. I like traveling, working out when I can, and cooking. Those are my main interests. So I'm really excited to be on this podcast today.
Nice. Well, and I know that your specialty is, family medicine. So I'd love to hear kind of what brought you into that, or what made that, be of interest to you.
Well, I initially applied for residencies for pediatrics and family medicine. So family medicine was kind of a backup. So when I was interviewing for the different positions, I got pediatrics and family medicine interviews. So during my family medicine interviews, I realized that the programs were more fitting for me because I could still see kids, and then I still had some interest in seeing adults as well. So I just decided to go the family medicine route. I really did enjoy family medicine when I was a medical student because I like the work-life balance. I didn't think it was as stressful. I don't think anybody likes stress, but I particularly don't like stress, as my husband will tell you. So that's why I chose family medicine. I just felt like it was more, if someone that wants to have children, that it provided me a better work-life balance. There's so much you can do with it. You're not stuck in just a clinic. You can do urgent care. You can do ER. Just a whole wide array of things you can do.
Dr. Badidi, I wanted to back up just a little bit. I love your story about where you are now. And for the listeners, a lot of times when you're thinking, I'm thinking becoming a doctor, I'm not sure whether it be biology or chemistry, whatever the undergrad was, and you decided to go to medical school outside of your country of Canada, let's say. Could you go through that thought process for the listeners? Because a lot of times, do I go to, in America, you got the MD school, you got the DO school, you have the foreign medical schools. That thought process you went to maybe better assist them in selecting the appropriate medical school for them?
Well, there's a couple of factors. I really didn't want to leave home, but I think it was, if I was in the United States, it would have been easier. I grew up in Canada, which if I remember correctly, there's only 20 medical schools. So if you want to become a doctor, there's not a whole lot of options for you. And so I was like, you know what? Let me just see what else is out there. Because there are other options other than the Caribbean and the United States for going to medical school if you're from Canada and you don't have many options. I also considered Ireland because a couple of my friends went to Ireland too. So I was like, let me one of my friends was telling me about the school that I went to, and I was like, let me try it and see, just apply and see how that goes. And I knew other people that were going there, so that's how I selected it because I knew people that had gone there and I knew other people that were going there. That helped me better make the decision.
And then when you applied for your residency that you were just telling us about, the pediatrics and family medicine, you had to take this at the ECFMG examination prior to applying to the residency in the medical school you went to?
Yeah, so just do your step 1 and step 2 as well. And thankfully I passed the first time, so it made getting into residency easier for me. If you struggle with those exams, residency can be a challenge to get into for sure. And I think from what I've heard recently, it's becoming more and more competitive, no matter what specialty you want to go into.
Well, I'd love to hear, I know, one of the big topics that, we have been discussing has been around this work-life balance and kind of figuring that out as a physician. So obviously it sounds like with this, focus in family medicine, that's helped with that. But I wonder if there's just, some overall things that you've found that's helped, as you've taken on, being a physician.
Yes. So when I had my daughter in 2018, I went back to work after 6 weeks, and I was not happy about that. The reason I went back to work so soon was because I was trying to get, I was in the process, the hospital that I worked at was sponsoring my visa, and I was almost done what I needed to do there. And so I was just thinking, let me just get this done as quick as I can so that I can apply for my green card. So I went back to work pretty soon. And so I was thinking I would never do that again because I bonded with her, but when it came to breastfeeding, it became more difficult because I wasn't home with her long enough. And so I decided in my next job, I was going to work sort of less. And so right now I work 3 days a week. It's long, but I just do 3 days a week. And actually I was talking to my current job about what will happen when I have another child, how I can cut down hours then as well, because I do want to bond with my child, at least growing up in Canada and having my friends having their 12-month maternity leave. It makes me pretty jealous. So, it's really hard to find a good work-life balance, but I'm really trying. And so that's why I choose right now to work. I just do 3 days a week right now. I work Tuesday to Thursday. So no Mondays, no Fridays, no weekends.
Dr. Badidi, I'd like to follow up. You mentioned you were on a visa. Some of our listeners or people that would be listening to this podcast would be like, well, that's me. In a short time frame that we have, if you could just kind of condense, that process, any things to be, for the listeners to be aware of that maybe frustrated you, but, ultimately you work through it and you wound up getting your green card.
Yeah, so you have to get a job that's willing to sponsor. Thankfully, I worked at a great hospital, at a great facility who was willing to sponsor my visa. The only thing was I was not used to, if you're trying to get a job at DFW, they can get other doctors. Nobody's going to sponsor your visa. So the main thing is, unfortunately, you have to be in a rural area. I was in Breckenridge, Texas. So you're going to have to just sacrifice 3 years. It's a 3-year commitment and just work in a rural area. We don't have much available to you, but it's still a great experience, teaches you quite a bit. So that's the main thing to keep in mind, that you have to be flexible. You're not going to get a big city. You're not going to have all the amenities you want, but it's a sacrifice you're going to have to make to get through that process.
I'd love to learn, just as you've gone through your career, have there been role models or people that you've met that have really kind of helped you, learn and kind of just continue to advance your career?
Actually, my husband, he's a hospitalist. So he's really, he's one of the actual doctors I look up to because he's very thorough in his coworkers will describe him as meticulous. So some doctors will rush through seeing patients and doing this and doing that, but he really takes his time with patients. I've seen him talk to patients' families for like an hour out of his day, answering all their questions. So other people may not do that. It's a busy day. He's always looking up things and how to help the patients. He makes sure he takes the most care of them. He doesn't speak ill of anybody. And he's just a very, very good doctor, very compassionate. So I look up to that in him. He's one of the best doctors I've ever met. Not because he's my husband, but he really is.
So would a contributing factor to your current work schedule with your daughter be that your husband's working like a 7-on, 7-off and it allows you some flexibility to spend time with your child?
Right now, he works quite a bit. The job he's doing right now is not 7-on, 7-off. They're considering that right now in his hospital because the current schedule is not working out for a lot of the doctors. So I think he's going to go to the 7-on, 7-off. They're going to eventually switch to that, but that's not what he does right now. But the fact that he does work a lot does give you some flexibility for sure.
What do you think what are some of the biggest challenges that you face, like becoming a doctor? So think of kind of some of our newer residents or people that are going to be becoming a physician this year. What's some advice you could give them on some challenges that they might, encounter?
One of the most, I work in an underserved area, so I work with a lot of Medicaid, non-insured patients. So one of the main things is just for them to be able to afford their medicine. A lot of diabetics, a lot of people have blood pressure. They will tell you, I can't get my medicine till next week, or I just can't afford that right now. And then they go a big period of time without their medicine, and then their sugar goes up, and then you're back to square one. So that's one of the biggest challenges I face is just people having resources. And even the ones with the insurance, a lot of the insurance don't approve the newer, really, really good medicines. They don't approve it because they want you to try all these older stuff first. So it's just very challenging. And some patients need an MRI or a CAT scan, and the insurance company will deny it because they don't think it's necessary. But then I'm like, you haven't seen the patient. So I think it's necessary, but you haven't seen the patient. But how are you able to determine that? So that's one of the biggest challenges I've found is people not having financial resources and access, like good, access to good care, really.
And kind of your advice around getting around that is just finding maybe alternatives of medicines or things that the insurance would cover.
Yeah, so I try to find the cheaper options for them. Some of those cheaper medicines are still good, but some of them, they don't work as great as the newer ones. But we just work with what we have. So I try to find alternatives for them. I try to, if there's something that they need, like an MRI of their back, I will just, if it's denied by the insurance company, what I'll do is I'll just refer them to a specialist. Maybe the specialist can have better luck in getting it approved and see what else they can do to help them.
I knew one of the big topics is, around obviously the shortage in physicians. I was just reading, I think they're projecting like 55,000, primary care physician shortage this year. What would you kind of say if, inspiring that next group of leaders and physicians, what do you like about being, a doctor, and what has made this, career fulfilling for you?
Well, being able to help patients, I always get excited when I see a patient for the first time. Their blood pressure is really high. Their hemoglobin A1C, their diabetes is just like, I'm like, how are you surviving? It's really, their A1C is really high. And as we work through the process, I see them like every 2 to 3 months, and I'm able to get that down. I find that really fulfilling. When I'm able to talk to a patient that has a young patient usually has all these medical issues or these complaints, and I'm able to sit them down and talk to them about their childhood and what led to this, because a lot of my practice, everybody in the clinic will tell you, I see a lot of mental health patients. It's not by choice, but they seem to lean towards, I get a lot of those, and just be able to sit down with them and talk about their childhood and their life and what has really led to where they are now. Because what I do find is a lot of my patients that have especially the young ones, that have a lot of physical complaints, there's always a root to it. Like why? And they will tell you, once they open up to you, they'll tell you what happened when they were younger, and all of a sudden it's manifesting in physical complaints. So it's always fulfilling to be able to hear their stories and be able to see how it can help them. And because sometimes you're the first person that's listened to them as their doctor. Nobody else, they don't have a whole lot of people a lot of social connections and people that listen to them. So it's always fulfilling when they trust me enough to tell me those things.
I love that trust and that empathy that really kind of is the core of it sounds like everything you do, which is amazing.
Yeah.
I wanted to give you, also a chance to talk about anything that you think, you would like to just communicate to our listeners. A lot of them are obviously, physicians in different fields, but if there's anything that, something that you just want to share in within the community, this really is about community building within, with fellow physicians.
Well, I don't know if medical students are listening, but for the medical students, I want to talk a little bit about choosing a specialty. So one of the things, don't do it for money, because money can do a lot of other things to make money, not just be a doctor. There's so many other things these days. just find what you're passionate about. What field are you passionate about? What are you good at? What are your skills? Not everybody can become a surgeon. If you know that you're not really good with your hand-eye coordination, maybe that's not the field for you. Because if you choose something that you love, and something that you're good at, you're more likely to be successful in that. And that's really my main advice for medical students that are thinking of specialties. And also shadow somebody in that field to see if this is really what you want to do. If you don't get enough shadowing through your school, try to find an extra, something outside of school. Try to find somebody outside of school to shadow, because this is a lifelong commitment. I mean, you went to school for this long. To quit midway is not worth it. So you just want to make sure it's something you want to do, and that you'll be happy in. And also, go based on your personality. If you don't like to talk to people, and you like to be in a dark room, or you don't really want to have a lot of patient care, maybe radiology would be better, or pathology. But if you're, I don't want to say socially awkward, but if you don't really like to talk to people, then maybe, something like pediatrics or family medicine may not be the best route for you. So also choose something based on your personality as well.
Dr. Badidi, building upon that thought, I was just thinking is here you're a female provider, you're well-versed, you're married to another physician, your child's going to probably live a pretty nice life. But to help those other female physicians who are thinking that they're going into medicine, I studied economics, so I'm a supply and demand guy. So I know in OB, there's like 83% of all providers coming out of training are women. Are there any areas that you see now that you're a practicing physician that, a female physician say, God, there's just not a whole lot of supply of women, whatever? That might be something based upon some of the other things you mentioned also, but it's like there's a huge need for women providers in these specialties. Is there any insight that you could give?
Yes, especially, I think surgery is one of the main ones that we don't see a lot of females, especially like orthopedic surgery, neurosurgery. So I think a lot of that is probably because of the work-life balance. It's not the greatest because you're just so busy. You don't really have a whole lot of time with your family. So that's something else I think people should consider when choosing a specialty. I would love to see a lot more women in those specialties for sure. But I think that's definitely a factor. So I would definitely like to see more women in that field, orthopedic neurosurgery.
And how have you, ever thought of doing private practice versus, obviously now you're part of a medical group, but tell us a little bit about how you go about, thinking about that or making those decisions.
That's interesting you ask, because one of my friends always tells me, she's a nurse practitioner, she always tells me, why don't you just open your practice? Why don't you, because because when you work at a hospital group or hospital, like a facility where you don't really have, to be honest, you don't have a whole lot of autonomy over your schedule, what happens. It's controlled by CEOs and people in that category. And so she was she's always been telling me, just open your own practice. And I was like, I don't know. I've considered it in the past, but it seems like a lot. So, and I've talked to my husband about it, and he's, it would be nice to have a spouse support for something like that, and he's not interested. So maybe one day if he gets interested, we'll think about it. But for now, I just work through the hospitals, work in a clinic, work through the hospital system. But it's definitely something I'm open to in the future. It's just, it can be satisfying, but it may not be all it's caught up to be, because it's just a lot of little nuances you have to think about.
I was going to say, what are the advantages of working, in a hospital system?
One of the advantages is that everything is you have a nurse, you have a medical assistant, everything, you don't have to worry about when they quit what to do, because that's not something that that's not something that you would be involved in recruiting. You would interview them, but you wouldn't be involved in recruiting them. If I have any issues, I know who to go to, because if I have my own clinic, any issues would probably be coming to me or the office manager. So it's just you kind of have that bubble where everything's just kind of done for you, and that makes it easier than you having to do everything on your own.
Kind of thinking future forward, I always like to ask is, how do you think medicine will change in the next, decade or so?
It was changing already. So when I was in residency and I got out of residency years ago, we didn't have telemedicine. So when there was a snowstorm or a patient couldn't make it to the clinic, there was no other options. If a patient can't make it to the clinic, they have to cancel their appointment or reschedule. If there's a snowstorm, patients just get canceled. 3 weeks ago, we had ice here in the DFW. To me, that was nothing, but everywhere closed. And we had to do telemedicine I did telemedicine for the 3 days that I was working. And years ago, that would not have happened. Years ago, what would have happened was patients would just be rescheduled. So medicine is definitely advancing in terms of telemedicine. I think it's a good option for people. I think even me, I do with my doctor as well, because sometimes he's only there once a week, and the day he's there, I'm working. So I can, just take a little break from work and just talk to him. Years ago, I couldn't do that. I just have to take that whole day off or half a day off and go to his office. So I think medicine is really advancing in terms of telemedicine. I think it's a very, very good option. I think there's going to be more of that as time goes on. Almost every field right now is doing it. I didn't think it was possible for hospitalists to do telemedicine, but it's emerging for them too. So I think that's where most of, with COVID, I think that's where most of it is.
Yeah, the convenience factor. Yeah, and the time that really, and obviously with COVID, it kind of rushed that in, and now it's, really commonplace for people. But it is a time saver when you're like, wait, I need to talk to my doctor about this, and I can get in.
Yeah, and it gives working mothers an option too. If you want to do something extra on the side and you have young children, you can work from home essentially. Just do some telemedicine.
Well, thank you again, Dr. Badidi, for your time. We really, really appreciate it. And I think this just helps kind of build that community within the physicians, and everything that they're doing to really make their lives a little bit easier. Hearing great advice from doctors like you. So thank you for your time today.
Thank you so much for having me. And y'all had some really great questions.
Thank you to all of our listeners. If you would like to be notified when new episodes air, make sure to hit that subscribe button. And a big thank you to Pacific Companies. Without you guys, this podcast would not be possible. If you would like to be a guest, please go to www.pacificcompanies.com. Thank you.